Okay, it's going. All right. I'm Miss Johnson Alexander with Dr. Delk. He's recording me. We're going to go. I'm going to finish up the body systems for you all. It's crooked. There you go. I really should just prop this up. All right. We're going to pick up on some things that I needed to clarify with the respiratory system. It's 16 to 20 breaths for an adult. For cardiovascular heartbeats, pulse rate, 70 to 100. And those are things that I left out when I was in front of you all. Now, nervous system. I'm going to talk about the parts of the nervous system. The disorders I talk about are disease processes are stroke and seizure. The first is the parts of the nervous system. You have your central nervous system, which is your brain and your spinal cord. That's all I cover is the central nervous system. I don't get into peripheral or any of the other different nervous systems. There are multiple parts of the nervous system. I just talk about the central nervous system. So that's brain and spinal cord. The brain and spinal cord operate with electrical signals. So we do conduct electricity not only to make our heart beat, but also to communicate throughout the body. So electrical signals. Then seizure is the simplest way to explain it is when the brain gets overloaded, kind of like when your phone might freeze, a computer might freeze up. It's too much information coming in. On any given moment, your brain is taking in how your body temperature and trying to help you maintain something called homeostasis, which is regular body system levels. So your body temperature has to be maintained, your level of hydration, your food, appetite, whether you're hungry or not, sleep, how something's crawling on your arm or someone's talking to you, your professor is teaching. Your nervous system is taking in all kinds of information for your whole environment, internally and externally. And a seizure for someone that has epilepsy is what it's called, but seizures on a regular basis with epilepsy, there's too much information coming in too quickly for the brain to process it. So with seizures, you want to make sure that the person is safe. Do not put anything in their mouth. You cannot swallow your tongue. Your tongue will relax and roll over and cover up your airway, just like we talked about with doing a head tilt chin lift. Okay, so when someone's having a seizure, you want to get them to a safe area. If they're sitting in a chair, you want to try to lay them on the ground so they don't fall out of the chair. You don't want them to hit their head. You don't want them to have on constrictive clothing. If they're wearing a suit and tie and it's buttoned up to the top, you'll unbutton it, you'll undo the tie. If they have on glasses, you'll take off their glasses, that kind of thing for safety. Then you just monitor them. You time when the seizure started so you can tell paramedics, because you will call 911, tell paramedics how long it's been going on. And if they are doing any posturing, are their arms folded in and legs folded in, or are they flared out? Tell them how they were positioned posturing. So safety is number one. Then also you want to make sure that the breathing returns. Okay, make sure breathing returns. For all the nursing majors, you'll hear some in nursing school called T-TOYS, which is time, oxygen, Yonkers suctioning, and well, that's it. And safety. But with this class, just worry about time and oxygen, meaning them breathing coming back to them. Okay. After it's over, you can turn them on their side. So if they do vomit or anything like that, they don't choke or aspirate on their own vomit. But you're not going to put anything in their mouth. That is a myth. You're also going to, so that's it with seizures. Safety and oxygen breathing returning is your biggest concern. Stroke. Stroke is, as I mentioned in class, you have a clot of some type that lodges in the brain. So we had this picture. You can see clots of different kinds. You can see plaque is the yellow in the blood vessel. Okay, that yellow plaque can break off and float in the blood vessel. If it gets lodged in the brain, the person has a stroke. If it's in a large vessel, they have a major stroke. Okay, if it's in a smaller vessel, they have a not as major stroke. But the purple are also clots, and those can break off and get lodged in the brain, in the blood vessels. So either way, you're going to end up with a stroke. For every, like the commercials say, time loss is brain loss. Anything past those clots, the tissue past it is not getting blood, so it is dying. It's not getting oxygen, it's not getting nutrients, it's not getting carbon dioxide and waste taken away, so on and so forth. It is dying, okay? So the acronym I teach is FAST, and that's face. The face could be paralyzed on one side. Face, arms, you want them to hold their arms out in front of them for 10 seconds. If one of the arms starts to droop, that's the side that is being affected, obviously. So they need to hold their arms out for 10 seconds. So that's arms. Speech is you're looking for, do they have a hard time coming up with words? Do they have a hard time speaking, period? Is it slurred, or are they not making any sense? Are they saying things like, hand me that elephant over there? And elephant obviously doesn't make any sense. So speech can have different variations. Time is just like with the seizure, you time when the symptoms started. People have had strokes that lasted for hours, okay? And they've also had massive strokes where they fell out. It was a big deal. You could see them immediately, see it going on. You're going to call 911. You're going to get them in a safe area and monitor them. But you have to get them to the hospital so that it can be figured out. Is it a clot causing the stroke, or is it a ruptured, blown blood vessel? Has the blood vessel got a hole in it, basically? Okay, so you can have a clot that causes a stroke or a ruptured blood vessel that causes a stroke. Next system is endocrine system. This is our hormones. Here I talk about diabetes. It's the major disease process. And the things involved are glands. Okay, glands like pituitary gland. Glands are in charge of body processes and things happening. They send the message out. So for you to feel hungry, or for you to feel like you have to go to the restroom, that's all a gland, a chemical message sent out. So chemical message says you need to eat, and the gland sends out that message, and the message goes to the stomach. Okay, it comes from the brain to the stomach. Time for you to grow. Human growth hormone is released. Hormone is the chemical messenger, and at night you grow. Okay. Pancreas, diabetes. Diabetes is a disease process where you want your blood sugar, just giving you numbers, between 70 and 100, okay? 70 and 100. So if you have diabetics and you take their blood sugar, you know what that number means. If the number is below 70 or sometimes around 70, they can exhibit symptoms of confusion, dizziness, things like that are affecting the brain, because the brain cannot store sugar. It has to have a steady supply in the bloodstream, okay? Then you have the pancreas. The pancreas releases insulin. There's also a part of your brain that releases insulin. That's how important it is. Insulin's job is to take sugar into the cell so we can use it to make energy. If that does not happen, our blood sugar goes up. If we're eating but the sugar is not going into our cells, then the blood sugar can go up. However, if we don't eat, if you decide not to eat breakfast when you wake up and you go on about your day, around the afternoon, you will get tired, lethargic. You can get irritable and cranky because your blood sugar is dropping. So that's why you have to have something to eat, and it's good to eat breakfast. Not maybe a huge breakfast, but it's good to eat breakfast because you've been asleep and have not eaten for hours and hours. Okay? Now, that's diabetes. When that blood sugar gets high, it becomes acidic. Okay, acidic. So now you have acid running through your blood vessels, and as we know, acid is going to mess up whatever it touches. So over time, those blood vessels in your arms and your legs, your eyes, those blood vessels anywhere, your heart, wherever, because your blood goes everywhere, it will they will erode. They will be damaged. Okay, so they're not going to be as functional. So therefore, that's why you see diabetics have to get things amputated. All right, because the tissue has died and they have to cut off that dead tissue. People going blind because of diabetes. So some diabetes is something that's going to kill you slowly and painfully if you do not control it. Take the insulin if you have to. Use the right diet. Exercise. When you exercise, it makes your cells want insulin or be receptive to the insulin you have to get that. It's receptive to the insulin. Insulin is the key to take sugar inside the cell. So that sugar is now inside the cell. So that's why exercise is important if you're diabetic or pre-diabetic. Liver. The liver has the pancreas and liver. You usually hear about the liver being susceptible for with alcohol. Pancreas also is susceptible, hates alcohol because it has to break all that alcohol down and cover the sugar. The liver has to break all the alcohol down and your other medications, anything that you're taking. Liver has over 500 functions. Very important, obviously. So pancreas, you only have one of them. But don't forget that alcohol affects your pancreas and can cause it to stop releasing insulin or stop releasing as much insulin. Just like if you decide to go that route with a large alcohol consumption, alcohol, beer, liquor and beer. Liver is your biggest gland. It secretes all kinds of different hormones, okay? Chemical messages are hormones and chemical signals. Now, urinary system, that's the bladder. Let's go in order. Your kidneys, your ureters, your kidneys, your ureters, and then your bladder. So your kidneys filter your blood, decide whether or not to keep water, reduce water, get out waste. It goes down the ureters into your bladder where you hold your urine. Okay, so you got two kidneys. They're very sensitive. If you get dehydrated, it can cause renal failure right there on the spot. That's acute renal failure. So you have two kidneys, two tubes that carry the urine down into your bladder. UTIs, what causes UTIs most often is something called a bacteria called E. coli, which is in all of us. It's in our anus, rectum, large intestine. We have to have it there. If we wipe incorrectly, that's why it's important for women and girls to wipe correctly from front to back, so we don't bring the E. coli to the front where our urethra is, where our opening is, where we urinate, and that E. coli will go up and then end up causing a urinary tract infection. Next, integumentary. Almost done. Integumentary is skin. It's our largest defense, and biggest thing with that is keep taking care of open wounds, which you'll learn in first aid, the first aid section. So you triple antibiotic, put on band-aids, take baths, monitor your skin for openings. So if something is burning, hurting, you have a cut somewhere, and it's our biggest. It's the biggest part of our immune system. Actually, is our skin. So then we have digestive last. It's the components. Mouth is where we start to break down food and absorb nutrients. We have our mouth. Esophagus is where it goes down. And then the stomach. Now, acid reflux, some of you might get that, also called GERD. It's when the sphincter that separates our stomach from our esophagus, it softens and it relaxes and it opens up, and food can just go back up. Food and stomach acid, that's what causes the burning. It's literally stomach acid going back up your esophagus, okay? So after you eat, you don't want to eat late at night. You don't want to, and then lay down. You also do not want to, you want to stay away from tomato-based products at night and then laying down. You don't want to just eat and lay down. Then you have the small intestine, which is where most of our nutrients are absorbed, is in our small intestine. That's how we get it into our bloodstream, and water. And then we have the large intestine, which is where we, excrete our waste. And everybody's idea of regular, you should not go a week without having a bowel movement. I'll just say that. If your schedule is every day, if it's every other day, if it's every 3 days, that's you, but you want to stay with your schedule. And that's really, and that's about it. So let me go back to endocrine. I already talked about the blood sugar, I'm sorry. Well, that's it for the body systems. You have digestive, integumentary, urinary, endocrine, nervous, immune, respiratory, and cardiovascular. I only did those 8. So they will be on your midterm. So take heed for this information for your midterm.